Good morning. Thank you to the organizers for the opportunity to present, and I'm pleased to be presenting on behalf of co-authors from PEPFAR country teams, Ministries of Health, and headquarters. And this is our disclaimer. Due to significant efforts in the prevention of vertical transmission of HIV, the number of new child infections, shown in green, is decreasing, yet there were still 130,000 new child infections in 2022. The U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, works with and supports Ministries of Health in implementing comprehensive prevention of vertical transmission services. The objective of this analysis is to describe trends in HIV diagnoses and linkage to ART among infants in PEPFAR-supported programs from 2018 to 2023. We use PEPFAR monitoring, evaluation, and reporting, or MER indicators, which review facility-based aggregate data. We included African country programs supported by PEPFAR with complete reporting on MER indicators for HIV-exposed infants less than 12 months of age. We then included 18 African country programs as shown in the map. We used fiscal years 2018 to 2023, but for simplicity, we'll just refer to them as calendar years in this presentation. We analyzed trends, percent change, and absolute percent change across all PEPFAR-supported country programs, regionally and by program, for HIV-exposed infants less than 12 months of age, including infant HIV diagnosis, proxy infant HIV positivity, and ART linkage within the same reporting quarter as diagnosis. For infants diagnosed by 12 months of age, we also looked at the proportion that were diagnosed by 2 months of age. Across all programs, the number of infants diagnosed with HIV from 2018 to 2023 decreased by 43%, as shown in the orange. Correspondingly, the infant HIV positivity decreased from 2.2% to 1.3%, shown in the blue, an absolute percent difference of 0.9%. Among all infants diagnosed by 12 months of age, 36% in West Central Africa and 47% in Eastern Southern Africa were diagnosed by 2 months of age. Based on UNAIDS estimates, we expect that in breastfeeding populations, about half of new child infections occur during pregnancy, and thus we should be able to diagnose them with timely early infant diagnosis by 2 months of age. We see this approximately with Eastern Southern Africa, but we note that in West Central Africa, less than half were diagnosed by that time period. ART linkage improved during the time period, shown in blue, from 83% to 88%, an absolute percent increase of 6% due to rounding. The dotted line shows the 95% target set by UNAIDS and PEPFAR, and the country programs in aggregate had not yet reached that target. For country-level review, this graph shows ART linkage in 2018 in orange and 2023 in blue by country program. Countries are ordered by decreasing ART linkage in 2023, with 5 countries meeting the target at the end of the period. 14 of the 18 countries improved their linkage or remained the same during that time period. In this analysis, the number and proportion of infants diagnosed with HIV declined across PEPFAR-supported programs, likely reflecting overall improvements in general HIV and comprehensive PVT services. Note that this analysis is not able to capture individual interventions. In West Central Africa, the proportion of infants diagnosed by 2 months of age is lower than expected based on UNAIDS estimates, and this may indicate delayed diagnosis or missed diagnosis altogether in infants with in utero infection. This may reflect missed opportunities in PVT and EID services. Linkage to ART improved overall, but remained less than 95% for most countries, highlighting a gap in providing timely services and EID testing and linkage for HIV. Though we cannot evaluate individual interventions, things that have shown to improve ART linkage include retention services for mother-baby pairs and timely return of EID test results, including through things such as diagnostic network optimization and increased access to point-of-care platforms. We note that data may have been impacted by challenges with programmatic and MER data reporting. As we continue to make progress towards elimination of vertical transmission, we must assure that infants living with HIV are not left behind. Addressing missed opportunities in diagnosing and linking infants to care is crucial to ensure that infants living with HIV survive, thrive, and reach their full potential. And we thank the clients attending health facilities and countries in this analysis. Thank you.